Hello everyone, my name is Kyla Parks and today I'll be presenting on global health inequality. This issue explores how and why health outcomes differ dramatically across countries and populations and why it matters to all of us. Global health inequality refers to unfair and avoidable differences in health status and access to healthcare resources across populations. These gaps are shaped by income, geography, gender, and social or political systems. At its core, it's about who has the chance to live a long and healthy life and who does not. To give you a sense of scale, in high-income countries, average life expectancy is about 80 years. In some low-income countries, it's closer to 60. A child born in sub-Saharan Africa is about 15 times more likely to die before age 5 compared to a child born in Europe. During the COVID-19 pandemic, wealthy nations administer booster shots while many poorer countries still struggle to get their first doses. These statistics remind us that inequality is not abstract, it's lived reality. What drives these inequalities? Poverty limits access to nutritious food, clean water, and safe housing. Political instability can weaken health systems. Education plays a role. People with less schooling often lack access to health information. And lastly, global systems also matter. Pharmaceutical patents, trade restrictions, and economic policies all shape who gets care and who doesn't. Let's take a look at a couple of examples. In rural India, maternal mortality remains high because women lack access to hospitals and skilled birth attendants. In the U.S., indigenous communities face higher rates of diabetes and shorter lifespans due to systemic neglect and limited healthcare access. Globally, COVID-19 vaccine distribution showed how wealthier countries were able to secure doses quickly while poorer nations were left behind. There are important efforts underway. The World Health Organization pushes for universal health coverage. Gavi, the Vaccine Alliance, has expanded vaccine access for millions of children. Telemedicine and mobile health tools are bridging gaps in rural communities, and community-based programs empower local health workers to provide care when doctors are scarce. But solving health inequality is not simple. Funding is limited and often unstable. Some countries remain dependent on foreign aid, which may not be sustainable. Vaccine nationalism showed how wealthier nations prioritize their own citizens first. And there are ethical questions. How do we balance global innovation with local autonomy? As someone interested in political science and public service, I believe policy change is key. Governments must invest in primary health care, address social determinants of health, and collaborate across borders. For students like us, awareness is the first step, but we can also advocate for fair policies and support organizations tackling inequality. To wrap up, global health inequality is one of the defining challenges of our time. It shapes who thrives and who struggles, and it affects us all, especially in an interconnected world. While progress is possible, it requires commitment, innovation, and solidarity. I'd like to leave you with this thought. Health should not be a privilege of geography or wealth. It should be a universal right. Thank you and have a great day, guys.